I'm the director of the Center for Health Equity at the Louisville Metro Department of Public Health and Wellness. Our mission is a Louisville where everyone and every community thrives by expanding our reach when it comes to advancing health equity across our community.
Racism is a system that concentrates power for some by concentrating scarcity for many. So racism is fundamentally depressing the quality of life for all of us and reducing our ability to experience joy and wellness because our systems are designed around unfair power. The Center for Health Equity tries to advance health equity in a few ways. We analyze data to be able to tell the story. We try to support our partners to organize ourselves to advocate for equitable values. And then we really try to help shape a worldview for people that says we do deserve better.
The Health Equity Report is a service that we provide to our community where we analyze population health outcomes and help people to understand the ways in which social and economic conditions, how those root causes of health are impacting our health outcomes across the community.
So we developed the Health Equity Report by analyzing data across several health outcomes, visualizing that data so that it's accessible to residents, and then developing a communication strategy so that we can build advocacy around the Health Equity Report.
COVID-19 has illustrated a lot of the same things that we've been talking about in our health equity reports. So a lot of what we see, disparities in health outcomes, inequities in health outcomes, we're also seeing with COVID-19. We've tried to take the same approach we always do in Center for Health Equity, which is focusing on policies and ensuring that our residents have their basic needs taken care of. We also have been paying attention to data to look for inequities, which already exist, but we know are being exacerbated by COVID-19. So our goal is to make sure that we reduce health inequities that people are experiencing, and we think about ways to ensure that the right policies are in place so we can reduce the spread.
Lead poisoning is a complicated issue, being that lead was a material that we put into many products that increased the valuableness and utility of those products. However, over time, as those products break down, they can have the effect of poisoning people, especially those most vulnerable. And in Louisville, that's children. In Louisville, also, it has a much larger proportional effect on children in African American and other minority communities due to the fact that we have larger majorities of that population living in areas with older housing stock.
The Childhood Lead Poisoning Prevention Program is a CDC-funded program. We work closely with our state coordinator and a few others, but mainly the focus of the program is to prevent lead poisoning from happening in the first place through education and other cross-sector work, but then also to respond to and follow up to those children who have been exposed to make sure that their blood lead levels come down.
We're at a really interesting time in the history of our department. The Center for Health Equity has had the opportunity over the past almost 15 years in order to shape the direction of this department.
The Policy Summit of 2016, My Dream for Lou, was a 10-year anniversary celebration of the Center for Health Equity and evolution of our work. We worked alongside residents to define a policy agenda for the Center for Health Equity. But what's most important about the Policy Summit is our focus changed from community education to shaping decision-making and focusing on decision makers.
The equity issues before us today are bigger than they ever have been. So the possibility is great that we could decide collectively as a department to advance equity with even more passion and resources behind it, the work in order to make equity more of a reality in our community. Success for us will mean that everyone has a fair and just opportunity to be healthy.